Hello, and welcome to the 2020 PEBB Program Annual Open Enrollment Presentation for employees. The PEBB Annual Open Enrollment period is from November 1st to the 30th of 2019. In addition to this video, you can find additional open enrollment information at the PEBB webpage for employees at hca.wa.gov/PEBB-OE. You can also find information in the October edition of the 4-Year Benefit Newsletter, which was mailed or emailed to you on October 11th of 2019. Do you understand that that is the only open enrollment notice you will receive from the PEBB program? The PEBB program hosts benefit fairs all across the state of Washington, and they run from October 29th through November 15th. At the fairs, this is your opportunity to speak in person with a PEBB program representative, health plan representatives, and PEBB contracted vendors. Some of the fairs also include live presentations. See your October newsletter for the specific dates, times, and locations of these presentations. Topics include the medical FSA or DCAP, the UMP Plus plans, and the Centers of Excellence. In addition, the UMP Plus plans will be hosting 2 webinar events. Puget Sound High Value Network will be hosting a webinar on October 28th from noon to 1 o'clock. And the University of Washington Medicine Accountable Care Network will be hosting a webinar on November 7th from noon to 1 o'clock. You can register for the webinars at the PEBB website or at the address listed on the screen. Navia Benefit Solution will be hosting webinars on the Medical Flexible Spending Arrangement, or FSA, as well as the Dependent Care Assistant Program, or DCAP. Those webinars will be on November 1st and the 19th. Each session will begin at 1 o'clock. You can register at peb.naviabenefits.com. Just a reminder that PEBB Medical FSA and/or DCAP is only available to PEBB benefits eligible employees of state agencies and higher education institutions. So, what can you do during open enrollment? Well, you may change your medical and/or dental plans. You can reinstate previously waived medical coverage without showing proof of loss. You can waive enrollment in PEBB Medical if you have a TRICARE plan, Medicare, or other employer-based group medical. And you can enroll or re-enroll in the medical FSA and/or DCAP. Remember, you must enroll or re-enroll each year during open enrollment to participate for the next plan year, even if you don't anticipate making any changes to the plan or your contribution amounts. During open enrollment, you may add eligible dependents without proof of loss. Understand that if you are enrolling a dependent who has not previously been verified by the PEBB program, you will need to provide documents that show dependent verification. A list of valid DV documents is available on the PEBB website. In addition, you can remove dependents from your PEBB medical or dental plan. You can change your premium deduction to pre-tax or post-tax, and you can change the tax status of a dependent. In addition, you can attest or reattest to the premium surcharges if they apply to you. One of the surcharges is the tobacco use premium surcharge, which remains at $25 per account per month. Just a reminder that you can attest to the tobacco program at any time during the year. It does not have to be specific to the annual open enrollment window. You can also attest or reattest to the spouse or state registered domestic partner coverage premium surcharge, which remains at $50 per month. So what are the ways that you can make changes? Well, you can do it online through the PEBB My Account program starting November 1st. Changes you make online must be completed by 11:59 p.m. on November 30th, 2019. If you are using paper forms, they must be received by your agency's personnel, payroll, or benefits office by November 30th, 2019. And a reminder that changes made during open enrollment become effective January 1st, 2020. Lastly, University of Washington employees must use the Workday program to make their changes. So you can make changes online at the PEBB website via PEBB My Account at hca.wa.gov/my-account. You can make the following changes through PEBB My Account. You can change your medical and or dental plan, remove a dependent from your PEBB medical or dental plan, waive or enroll in PEBB medical, and attest to the premium surcharges if applicable. Remember that changes made online will show as pending a January 1st date and will not display as a change until 2020. In My Account, you can view or print a statement of insurance. Sign up for the PEBB program's email subscription service. You can also view your enrolled dependents, your current medical and dental plan enrollment, long-term disability insurance, premium surcharge attestations, and basic life and basic AD&D insurance. Supplemental life and AD&D insurance is available at the MetLife website. Again, a University of Washington Workday reminder that if you are a University of Washington employee, you do not have access through PEBB My Account. You must use the Workday program to make any changes. If you do attempt to log into the PEBB My Account, it will result in an error message as you see on screen. So what can't you do in PEBB My Account? Well, you can't add a dependent to your medical plan. You must use the 2020 Employee Enrollment Change Form, and you must provide proof of the dependent's eligibility with the enrollment form. You also cannot enroll or re-enroll in the medical FSA or DCAP. You must submit the 2020 open enrollment form to Navia Benefit Solutions, or you can enroll online at peb.naviabenefits.com. So how do you get a form? Well, you have the following options. You can ask your personnel, payroll, or benefits office staff for a form, or you can go to the PEBB webpage on the Forms and Publications section. Forms for 2020 are available starting November 1st, 2019. If you're not making any changes and your medical and dental plans are still available in your area, you don't have to do anything. You will remain enrolled in your current plan. What are changes that can be made all year round, not specific to open enrollment? So you may enroll in or make changes to your supplemental life and AD&D insurance. You can make changes or enroll in supplemental long-term disability insurance. And you can enroll in auto home insurance through Liberty Mutual. Understand that for the life and long-term disability, insurance carrier approval may be required. So let's take a look at the 2020 PEBB premiums. So understand this slide speaks specifically to state agency and higher education employees. You can find your new premiums in the For-Your Benefit newsletter from October. You can also go to the PEBB website and view the premiums as well. Understand that if you are not a state agency or higher education employee, your employer determines the rate of your PEBB premium. Counties, municipalities, tribal governments, and other employers, as well as education service districts, K-12 school districts, should contact their agency's personnel, payroll, or benefits office for your premium information. Let's take a look at the PEBB dental plans for 2020. The same dental plans will be available for 2020 as last year. They are the Uniform Dental Plan, Delta Care, and Willamette Dental. And there are no changes with dental benefits for 2020. This is a reminder that Delta Dental of Washington administers both the Uniform Dental Plan, which is our preferred provider plan, as well as the Delta Care program, which is our managed care plan. So two different networks, both administered through Delta Dental. Reminder that the networks of providers are different. You should call the plans directly to verify which network your dentist participates in. For the Uniform Dental Plan, that's 1-800-537-3406. For Delta Care, that's 1-800-650-1583. Let's take a look at PEBB medical plans for 2020. Again, the same plans are available for next year as they are this year. PEBB offers Kaiser Permanente Northwest, or KPNW, Kaiser Permanente Washington, or KPWA, and the Uniform Medical Plan. Caution that there are some changes in the service areas for 2020. We'll go over that here in just a minute. For Kaiser Permanente Northwest, they offer the Classic and CDHP with an HSA, and CDHP is a consumer-directed health plan with a health savings account. Kaiser Permanente Washington offers the Classic, the CDHP with HSA, the Sound Choice, and Value plans. Again, those are all the same plans as in 2019. The Uniform Medical Plan offers the same plans this year as last year, which include the Classic, their own CDHP with an HSA, and the two UMP Plus plans. Again, that's Puget Sound High Value Network and the UW Medicine Accountable Care Network. Plan availability for 2020. Understand that plan availability differs by plan type and place of residence. There are some changes for 2020. Please refer to your October for-year benefit newsletter for some of those changes. Plan availability can also be found in the 2020 PEBB Employee Enrollment Guide, as well as at the PEBB website. For UMP Classic, UMP CDHP with an HSA, they are available to subscribers worldwide. The UMP Plus plans for 2020, the University of Washington Medicine Accountable Care Network is available in select counties in Washington, which includes King, Kitsap, Pierce, Skagit, Snohomish, and Thurston. New for 2020 is Spokane County. Please note that the following provider groups will no longer be available to the UW ACN plan. That's Island Hospital and Overlake Medical Center and Clinics. For the Puget Sound High Value Network Plus plan, they are available in select counties in Washington, such as King, Kitsap, Pierce, Snohomish, Thurston, and Yakima. And note for this plan, this network, that it is being removed from Spokane County for 2020. So while the Puget Sound High Value Network is leaving Spokane County, the UW-ACN plan is joining. So there will still be a plus plan in Spokane County. It will just be a different network. In addition, the Puget Sound High Value Network added the following providers: the Poly Clinic and the Rainier Health Clinic, which includes Chi Franciscan, CityMD, Franciscan Medical Group, Northwest Physicians Network, the Doctors Clinic, Pediatrics Northwest, Highline Medical, and Primary Care Northwest. Understand that Puget Sound High Value Network did have some loss of providers as well, including Multicare, Evergreen Health, and Overlake Medical Center and Clinics. Plan availability for Kaiser Northwest, Kaiser Permanente Northwest for the Classic and CDHP with HSA plan. Those are available in select counties in Washington and Oregon State. There are some new counties and zip codes for 2020, both for Oregon. That would be Clackamas County, zip code 97028, and Marion County in Oregon, zip code 97350. For Kaiser Permanente Washington, the Classic, high deductible with HSA, and value plans are available in select counties in Washington, Oregon, and Idaho. But do note that there were a few counties that had partial coverage which have been removed for 2020. Those counties include Grays Harbor, Lincoln, Pend Oreille, and Stevens. Also, service areas in Oregon and Idaho have been removed for Kaiser Permanente Washington. But do note that members who live in these areas but work in counties served by KPWA can stay enrolled in the plan and visit local KP facilities. Again, that's if you live in these areas but work in counties served by Kaiser Permanente Washington, you can stay enrolled in the plan. In addition, San Juan County was removed from the Kaiser Permanente Washington network. The live-or-work rule does not apply to San Juan County residents. For Kaiser Permanente Washington Sound Choice plan, that is available in select counties in Washington, which includes King, Kitsap, Pierce, Snohomish, Spokane, and Thurston. All right, let's look and see if there's any medical plan benefit changes for 2020. For the Kaiser plans, both Northwest and Washington, there were no changes to the benefits for the 2020 plan year. There were several changes for the Uniform Medical Plan. Let's review some of those. UMP will be increasing the lifetime limit for nutritional visits from 3 to 12. They'll also be offering a 24/7 medical advice through the Advice 24 nurse line at 800-267-6729. Please note that the UMP Plus UW Medicine ACN plan will keep its own nurse line, which is 855-520-9500. UMP will be removing Tier 3 from its preferred drug list. If you are currently using a Tier 3 drug, there is an exception process that will be available if your drug is no longer being covered. UMP has also added an annual $4,000 prescription drug out-of-pocket maximum for families. Understand that the individual prescription drug out-of-pocket maximum remains at $2,000. That's $2,000 for the individual. What's new is the $4,000 for a family. UMP also increased the medical out-of-pocket limit for a single member under the family plan who is enrolled in the high deductible plan, or the UMP CDHP plan. It will be $6,900. It was $6,850 in 2019, so a $50 increase. UMP will also be helping expectant mothers manage their health during pregnancy through the BabyWise maternity program. And with Health Equity, which is the health savings account vendor, for UMP, they will be issuing new debit cards in December of 2019 for members who enroll in the UMP high deductible plan for 2020. There will also be a new phone number just for UMP high deductible members. That number will be 1-844-351-6853. Additional benefit changes for UMP is that there is going to be some new pre-authorization requirements for some services. To learn more about that, visit the HCA website at hca.wa.gov//UMP/PEBB-open-enrollment. And you should also read your UMP Open Enrollment newsletter that was mailed on October 17th and pictured on the screen. Another change, not really a benefit change, but there's going to be a new website for your Uniform Medical Plan starting in 2020. It's going to have a new address. So it's regents.com/UMP/PEBB. And that's where you can learn and get all your information for 2020 benefits. Do understand that the current site where you've been going to will host 2019 information through December of 2019, but it will be going away at that point. So some medical plan reminders regarding open enrollment. The employer contributions to an HSA for 2020 are not changing from 2019. For an individual, that's $700.08 per year. For a full family, it's $1,404 per year. And that's, as a family, that's an employee and one or more dependents. The IRS maximum contribution amounts to an HSA, however, did increase for 2020. So an individual can contribute up to $3,550. That's a $50 increase. A family can contribute $7,100. That's a $100 increase. And if you're age 55 or older, you can contribute an additional $1,000 per year. Again, that's the same as last year. Do note that HCA contributions and employee contributions and wellness incentives all count towards the IRS maximum amount. So that's the employer contribution as well as the employee contribution and any wellness incentive earned. If you are currently enrolled in a high deductible plan with a health savings account, and you're going to turn 65 in 2020 and plan on enrolling in Medicare in 2020, you should probably consider changing your medical plan for 2020. We suggest you seek professional tax advice before remaining enrolled in a high deductible plan with an HSA when you plan on enrolling in Medicare. The IRS may impose a penalty if you continue to contribute to an HSA when entitled to Medicare. as Medicare Part A can be retro-enrolled up to 6 months. Let's take a look at the flexible spending arrangement and dependent care assistance program. So for 2020, the maximum annual contribution amount is remaining the same. For a single person or married couple filing joint income tax returns, that's $5,000. If you're married filing separate income tax returns, you can each do $2,500. The maximum annual contribution for the flexible spending arrangement, the FSA, is increasing in 2020 to $2,700. That's a $50 increase from 2019. Some reminders, again, you must enroll or re-enroll each year during open enrollment in order to participate for the next plan year with the FSA or DCAP programs. And that's true even if you are not changing your contribution amounts. You may not enroll or re-enroll in a medical FSA if you or your spouse or state registered domestic partner is enrolled in a high deductible plan with an HSA in 2020. 2019 medical FSA enrollees who enroll in a high deductible plan for 2020, you must use all of your FSA funds and have all claims paid by Navia Benefit Solutions by December 31st of 2019. If you don't do this, no contributions, either yours or from your employer, will be made to your HSA account until April 1st, 2020. You won't be losing any contributions, they just won't be there until April 1st of 2020. So make sure to use up all your FSA funds by December 31st of 2019. Let's take a look at life and AD&D and long-term disability benefits. There's no changes to these benefits or rates for 2020, but understand you could see a premium change if you're changed your age bracket. And remember, rates are based on your age as of December 31st for the next plan year. And of course, if you increase or decrease your coverage for life or AD&D coverage, that can change your premium as well. If your employer offers PEBB medical insurance only, understand that life and AD insurance is not available to you through the PEBB program. Contact your agency's personnel, payroll, or benefits office if you have questions about life or AD&D insurance. For long-term disability insurance, the 30 and 60-day benefit waiting periods for supplemental LTD will no longer be available in 2020. If you currently have one of those waiting periods, you will need to switch to a 90-day or longer waiting period. If you do not make a change, you will be defaulted to the 90-day waiting period effective January 1st, 2020. Just as a reminder, starting in 2020, employees will now be eligible for paid family and medical leave, which is kind of the reason the 30 and 60-day benefit periods will not apply anymore. Remember that the Employment Security Department is administering paid family and medical leave. Call them with your questions at 833-717-2273 or visit the paidleave.wa.gov website. For long-term disability insurance, there are no changes to rates for 2020. But again, you could see a change in your premium if you change your waiting period or if you have a change in your monthly base pay. Again, if your employer only offers PEBB medical insurance, LTD insurance is not available to you. Again, contact your agency's personnel, payroll, or benefits office if you have questions. Let's take a look at the premium surcharges and their attestations. For the tobacco use premium surcharge, you only need to attest when you or an enrolled dependent has a change in tobacco use, or you return from waived status to be enrolling in medical, or you enroll a dependent age 13 or older in PEBB medical. Those are the times when you need to attest. You can visit the PEBB website to find the change form, as well as when the premium surcharge does not apply, and the listing of tobacco and non-tobacco products. For the spouse or state registered domestic partner coverage premium surcharge, you will need to attest to this surcharge if, During open enrollment, you enroll your spouse or state registered domestic partner in PEBB Medical for 2020. You may need to reattest for them if you attested in 2019, and you will cover a spouse or registered domestic partner on your PEBB Medical for 2020. How do you find out if you need to reattest? Well, you're going to get a letter from the PEBB program towards the end of October to tell you that, hey, you need to reattest. You can also use the PEBB My account starting November 1st. You can attest and find out if you need to reattest or not. Remember, UW employees must use Workday to attest. And you can always ask your agency's Personnel Payroll Benefits Office if you need to reattest as well. So for the spouse or state registered domestic partner coverage premium surcharge, you can attest or reattest during open enrollment through the PEBB My account. But again, it has to be no later than 11:59 p.m. on November 30th. And if you are using the 2020 premium surcharge attestation change form, your employer must receive that form no later than November 30th. And again, University of Washington employees must use Workday to make their changes. If you are required to attest but don't within the deadline, or if your attestation results in you incurring the surcharge, you will be defaulted to incur the $50 monthly premium surcharge. This is in addition to your medical premium, and it becomes effective January 1st, 2020, and it remains for the rest of the plan year. Your next opportunity to attest again would be when a special open enrollment event occurs. And you can find at the PEBB website a listing of all the special open enrollment events and what changes are allowed for those events. In addition to a special open enrollment event, you have no later than 60 days after your spouse or registered domestic partner employer-based group medical status changes, or you can reattest during the next annual open enrollment. If you have a question you want to appeal, you feel that the surcharge should not apply to you, you can appeal through the appeals process. Please visit the PEBB website for information on the appeals process. Let's talk about the Smart Health program. Smart Health is the state's voluntary wellness program. A reminder that only subscribers who are enrolled in PEBB Medical can qualify to earn the wellness incentives. The incentives remain for 2020 as they did in 2019. There's the $125 reduction in the employee's 2020 medical deductible, or a one-time deposit of $125 into a health savings account if you are enrolled in a high deductible plan with a health savings account. There's also the $25 Amazon.com gift card for completing the well-being assessment. Remember that spouses or registered domestic partners who are enrolled in PEBB Medical can participate, but they are not eligible for the financial wellness incentives. So they can review the website and do the activities, but they cannot earn the financial wellness incentives. Only the subscriber can do that. So what's new for Smart Health? Well, they've changed the incentive deadlines for 2020. So for subscribers continuing enrollment in PEBB Medical or enrolling with an effective date between January and September of 2020, your date to meet your incentive deadlines is going to be November 30th of 2020. If you are enrolling in PEBB Medical with an effective date between October and December of 2020, those employees will have until December 31st, 2020 to hit the incentive deadline. To learn more about Smart Health, visit smarthealth.hca.wa.gov. So lastly, some contact information. Please remember to contact the plans directly for help with benefit questions, ID cards, claims, finding out if your doctor or dentist contracts with the plan, choosing a doctor or dentist, and making sure your prescriptions are covered. You can find plan contact information at the PEBB website. You can contact your agency's Personnel Payroll Benefits Office directly for eligibility questions or changes, enrollment questions or procedures, premium surcharge questions, finding forms, adding or removing dependents, life, AD&D, and LTD eligibility enrollment questions, and payroll deduction information. Thank you for watching this presentation on the 2020 PEBB Program Annual Open Enrollment.